Parkinson's disease is a clinical diagnosis. I will now walk you through the algorithm I use when evaluating a patient for PD. It involves the following 4 questions. Is their history consistent with Parkinson's? Does their examination have signs of Parkinsonism? Are there supportive features? If yes, count them. Are there any red flags that would make me pause? If so, count them. In order to make the diagnosis of PD, the history and examination must be consistent, and the number of supportive criteria should be greater than the number of red flags. For history, since PD is a chronic and slowly progressive process, I'm looking for patients to develop symptoms over many months to years. On examination, they should have the hallmark feature of Parkinsonism, or Bradykinesia, in addition to at least one other sign, meaning rigidity or the presence of a rest tremor. Regarding supportive features, there are 3 clinical findings to look for. The first one is the presence of a resting tremor. This is a supportive feature because the most common cause of a resting tremor is PD. The second supportive feature to look for is the clear, dramatic, and sustained response to levodopa. Patients will initially report that they feel nearly normal again, and over time, they'll start to see that there's a clear response because they'll develop fluctuations or wearing off of the benefit before the next dose of their medications. The third supportive feature is dyskinesia present with the administration of levodopa. Dyskinesia are signs that occur in the middle stages of Parkinson's disease. They are often mild initially with head nodding or truncal swaying. However, they can increase with time and involve all parts of the body. Red flags in the history and exam might suggest an alternate diagnosis. There are 5 red flags you should look for. The first one is recent exposure to medications that affect dopamine in the brain. The second red flag is early balance problems, often accompanied by falls. The third red flag is early and severe non-motor symptoms, including the following: cognitive impairment, difficulties speaking and swallowing, autonomic symptoms such as orthostatic hypotension, constipation, urinary urgency, and temperature dysregulation. The fourth red flag is a lack of non-motor symptoms. The fifth red flag is no progression of symptoms. Now we'll go through a case to walk you through how to use this algorithm. Mr. M is a 62-year-old male who came to your office because his partner noticed a tremor in his left hand. They first noticed this in the fingers, but then it spread to his hand and arm. Recently, he has felt a tremor in the left leg. This doesn't affect his ability to write, type, or complete his activities of daily living. He will voluntarily control the tremor by clenching his fist or putting his hand in his pocket. His partner has also noticed the tremor when he's walking and notes that he doesn't swing that arm either. Overall, he's still very active, but has a harder time keeping up with his partner when they're walking. He doesn't think that he can smell as well as he did in the past. He otherwise denies issues with his balance, falls, memory, speech, swallowing, or other symptoms. His examination is notable for the following: normal facial expressions and speech, slight rigidity at the left wrist that is brought out with activation maneuvers, mild bradykinesia with rapid alternating movements, a mild resting tremor in his left upper extremity, but no tremor when his arms are extended or when he is writing. During gait testing, he has decreased arm swing on the left, and the tremor is present. Now that you know more about this patient, it's time to go through the 4 questions in our algorithm. Is their history consistent with PD? This patient's course is chronic because symptoms have been present more than 3 months. His symptoms are also progressive. Both of these findings are what we would expect for a neurodegenerative disease like Parkinson's. Does their examination have signs of Parkinsonism? His examination has asymmetric bradykinesia, as well as rigidity, and a resting tremor, consistent with PD. Are there supportive features? He has one supportive feature, a resting tremor. He has not tried levodopa, so we don't know how he will respond. Are there any red flags that should make us pause? There are no red flags described in the history or on the examination at this time. The number of supportive features, 1, outweighs the number of red flags, 0. That, combined with his history and examination, indicates that Parkinson's disease is seemingly the most likely diagnosis. However, to be certain, we'll have to see how he responds to levodopa and how his symptoms progress over time.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.